group was the data connection group, and our conversations were also very exciting, fun. We had great participation with a lot of people providing opinions. And what happened is we got towards the end of our time, and I realized I hadn't really paid a lot of attention to my slides, and so that might show up here as you see this. So I've asked, as I do give this presentation, that not only can you ask questions in the middle of it, but group members can stand up and provide input as I go along. So our basic goals, of course, is we're looking at how do we get data flowing between systems, and we viewed ourselves as being, with the data activation and James' group, they are all the tools that collect data. Then on the other side of us was Mark's group, the data activation, where if you actually get that data in a structured, coded way into a system, here's the fun things you can do with it. So we're in between. We're that pipe in between. And so we discussed what problems exist with that pipe in between. What's not going on? What do we need to solve there? And what can we work on after the meeting's over? So I pulled up, James put this slide together at the beginning of the meeting around our data connection. And we did, I did kind of reorder them from James' original slide to show what priority we came up with. So we were, of course, focusing on standards. Simply that's certainly plays a major role in data connection. And we wanted to focus on standards around family history and transmitting genetic test results. A third item that came up in priority was the general promotion of getting laboratories to create interfaces with all of their customers. A fourth priority was looking at genomic data repositories and developing interfaces to move data in and out of genomic repositories. So here's the topics and issues we came up with. When we were looking at data standards for family history, it was determined, of course, that the pedigree model was considered to be a well-established standard. But as Kevin mentions, within HL7 we have CCD and CDA, and now this FIRE, which is a development process, is not offering the robust family history pedigree in there. So we want to concentrate on what's going on with those HL7 efforts and try to promote them to not go in the direction that they're going, but to promote the full pedigree. So then there's also the issues of just promoting these standards. We've mentioned AHIC many times, and we don't know how many people out there are even aware of the AHIC core data set, so we need to promote that. We need to align this with different use cases and market demand. And there's the implementation part of it, and there's some barriers to adoption that I'll get into a little bit later. So the same thing, similar things came up with the data standards for genomics. Those standards aren't not completely well established at the moment, and so there was talk around how can we help that development process. Once again, for this, we also have to work on promotion of this standard, get people educated to know what is available, what's being worked on, and then what are the implementation barriers. Let's identify those, and so we can help promote adoption. So then another priority was what we described as just the general issue of getting laboratories to be able to report results to electronic health records. So this wasn't just a specific around getting laboratories to adopt a specific standard, but just a general thing about if we look at the industry today, labs aren't developing these type of interfaces mostly because their customers aren't demanding that. And so we want to affect that demand. How can we affect that demand and encourage laboratories to develop interfaces, and especially shared interfaces that can be reused. We also had a lively discussion around how do we model data to store the pedigree and electronic health record. We had vendors in our group. Mark Hoffman and Cerner told us that, of course, from the vendor perspective, they don't need to be told exactly how to do that data modeling, just that the demand is there, that their customers will see value in it. And but we were also talking about the issue that if we look at the current family health history tools that are available today, if any of them decide to give the feature of exporting the data in an HL7 interface, they can export that data using that HL7 interface, but where does it go to? And how does it get received? How does that HL7 interface data get into the EHR? So that's an issue that needs to be solved. Then the last priority that came within our group was around the genomic repositories and the issue of extracting data out of those repositories, the clinical data, and putting them into the EHR. So here's I just have a couple of slides of some next steps for us. So it was determined that we should develop some use cases that really focus on the transmission and interoperability of this data. So not just a general clinical use case, but the more focused use case saying the patient enters the data in this tool. How does that data move from that tool into an EHR? And then we want to determine, really what's the current status of the adoption of these standards. I think most of us really aren't sure how many people are adopting these standards. Is it really just a few? Are there some folks out there that are doing this that we aren't aware of and that we need to maybe bring in and collaborate with? So we want to do a sort of a status assessment of how much of this is going on. We also, part of that, it was discussed that, of course, within the meaningful use stage 2 requirement for family history, that's a measure requirement. In other words, on the EHR user side, the meaningful use has a requirement that you report on a list of, I think there's 64 different measures that you're supposed to use your EHR to report on. And out of that 64, you get to choose either 9 or 12 of those measures that you will use your EHR to report on. And family history is just one of those measures. And so we're curious as to how many people are choosing to report on family history and how many aren't. We're thinking that maybe we could contact somebody within CMS to find that out. I did share with our group that I discovered just a few days ago that within Intermountain Healthcare, they have chosen not to report on family history. And that was a process that I wasn't involved in, and I'm sure that's the reason why they didn't involve me, because they knew what I would say. Anyway, so that's some information that we think we'd like to know more about. When we talk about developing or influencing the development of standards around the transmission of genomic data, it was Larry Babb from Partners told us that the work that was going on with ClinVar, and that we should encourage these type of groups to participate in that HL7 process. And that's a fantastic idea. I think HL7 is always, at least this is my perspective, I feel like within our clinical genomics work group, we feel like we're too small of a group of people. We don't represent enough of the industry and the user base out there and the stakeholders. And so we're always looking to include more people in that process. The next item is to just promote the use of family history standards within the clinical community and find that clinical champion.
If I can just comment briefly on the bullet that says ClinVar.
Yeah.
I think it's important to recognize that there's going to be an announcement very soon about a new resource called the Clinically Relevant Variant Resource, which is targeted to have be a repository for genomic variants that are specifically actionable And one of the specific aims of that is to actually have that resource integrate with electronic health records. And so there are a number of folks, some who are at this conference and others who are engaged in conversations that are going to be directly working on that. And so I would just say to make sure to add that specifically and explicitly into the strategy going forward.
And tell me the name of that group again.
The Clinically Relevant Variant Resource, or CRVR.
CRVR, okay. Great. Thanks. So this next bullet item really gets back to the input from the vendors we had in our group, and that is they'd be willing, any vendor is willing to expend the resources to develop more robust family history tools, but they have to feel like there's the demand out there. So we feel like we need to find those clinical champions, generate some sort of demand within the clinical community that they have an EHR that can provide a robust tool. Just the final slide here. So some other next steps. I had mentioned the promoting to get labs to offer more universal interfaces. Once again, now Elaine Lyon addressed this, and this is something that we have been discussing as Intermountain has been working with ARUP, and that is they said that they'd be happy to work on these interfaces. Now, for laboratories, it's going to cost them money and time and resources, but if they feel like if there's a demand from their customers to be able to have an interface so the customer can receive the test results, the coded and structured test results as opposed to a PDF, that they'd be willing to do that. So we'd like to kind of promote that further beyond just the Intermountain ARUP relationship, but amongst other labs and other healthcare systems. And part of that is, and Stan Huff mentioned this in his presentation, is besides just having that interface of receiving the test result, we should have a test ordering interface. And so that data, in fact, there's a lot of data. If you look at the forms that clinicians fill out when they order a test, there's quite a bit of patient information on that form. And why are we doing that? Shouldn't the EHR fill in that form and electronically, and of course the clinician will have to fill out some other information, but most of that could be filled out by the EHR and go through the interface to the lab. So that's something we'd like to promote. And lastly, second to last, part of that lab incentive is to have those interfaces. This is kind of a value proposition that we feel like we should talk about, and that is the lab being able to handle when the variants change. And so that's sort of like a value proposition. I didn't say that right. When the interpretation of the variants change. We feel that that's a value proposition in this. So the last thing we have is, what is really the barriers to implementation of these standards and transmitting this data? And it comes down to money. So if we want to get the world out there to be able to start exchanging this data, either generating it on one end, putting it in some sort of a data model, transmitting that data, receiving it on the other end, it all comes down to money. And so in order to get organizations to be willing to spend that money, then we have to give them a value proposition. Is this going to save time? Is this going to work within the workflow of the doctor? Does it offer real clinical value? What value is it to the patient? And so we obviously think all of those answers are in the affirmative, that yes, it does all of those. But we actually have to create that argument in clear terms and show how that will save dollars. And that way we can get the money that we need to develop these interfaces and accomplish these goals. So that is our, any other comments from our group that wanted to put in some comments too? Any other questions? I guess we're done with ours then.
Hi. So, just quick question. When you guys were working on this, did you talk about taking data from one family history tool to another, and not just from the HR to the family history tool and back, so that there can be ways to view the same information, within different tools?
Right. So the vehicle to do that would be the HL7 pedigree model.
Right.
We felt that was a well-established standard already. So all that really has to happen there is that the family history tools just, in the software itself to set up that interface to be able to generate that HL7 message or receive that HL7 message.
Okay.
So I think that could be done today.
Okay. And so.
And just as an example, Kevin Hughes's Risk Apps tool uses HL7 to import and export data.
I think we did, as part of our discussion, discuss the need to clarify the various systems that we would need to or want to facilitate exchanging that data, so that we're not overlooking